You have these miserable back pains. It starts in the morning when putting on your socks. You can hardly bend down. Then it gets worse during the day and someone tells you, oh, maybe a herniated disc, and you don't know, but you're afraid of getting surgery. I am Roland Liebscher Bracht, and I will explain to you how back pain develops, most of them. And what you can do about it. Sina will show the exercises. Let's start right away. But first, where do these back pains come from? Look, we sit for large parts of the day, not only at the table or desk, but also on the bus, train, in the cinema. And we even sit while riding a bicycle. What happens in this pelvic position? We have a muscle that is super important for this, that is the hip flexor. It is anchored here and then it goes over the inguinal ligaments here to the lumbar spine with the hip extensors, which are anchored here at the back. Pulling forward more and more, pulling forward and downward. The muscles pull back against it, and when you pull forward and backward, where does that pull go? It pulls on the intervertebral discs, and the body warns you of that. It should not happen to you, and that's why we will now show you what you can do about it. Sina, please just stand to the side and now place your hands on your lower buttocks. Go lower, lower. Why lower? You need to pay attention because you can overextend yourself in various planes. You can overextend in your upper body, in your lower back, and in your hip axis, and that's what this is about. And I want you to feel that exactly, and that's why grab your own buttocks, just like Sina does, because now you have exactly the point that needs to be pushed forward, under control with your hands. Sina, try this. Now simply push the pelvis forward with your hands, and then you will notice that prevents your lower back from overextending. Please try that. Another important trick is to try to pull your belly button in. Push forward and pull your belly button in. Do you notice that you feel much more stretch in the groin than in the back? That's what matters because you want to lengthen the hip flexor, and if you only overextend at the top, it won't help. There is only very little stretching on the hip flexor. The more you push the groins forward, exactly at the height where Sina pushes forward with her hands and pulls in the belly button, the more you are in the right stretch. And now we do the whole thing because you may not stand so securely against the wall. Sina, go to a wall. We'll use this one here since it's conveniently nearby. Now place both hands slightly wider than shoulder width and a bit higher than your shoulders. This is a very good starting position. And now, basically the same thing happens. First, become aware of your pelvis, so focus on the groin area, pull your belly button in, straighten your pelvis, and then gradually push your pelvis forward. And you can control yourself nicely with your hands so that you don't arch too much, but push forward down here, maybe even stand a little wider apart, shoulder width apart, will be a bit more relaxed. So, and now you feel the same stretch again, but you are secured, you can hold on to the wall nicely. Where does it hurt now? It hurts in the groin, it can hurt in the hip joint, it can even hurt in the abdomen, or it hurts in the back. Don't be alarmed if you feel a pull in your back. Just think that the pulling is making the muscles briefly noticeable. You are doing this at an intensity that you can still bear, and when you come back out, what was previously short is a bit longer. Then we'll go to the floor. Sina, come over here. Please get down onto the crawling position. Yes, that is the basic position, and now it's all about becoming aware of the back and pelvic position. Make a cat hump and go up with the lower back, yes, and now the opposite, let it sag and now up again, and when the position is like this, stay like that. Move your hands approximately 10 centimeters forward, keeping your back as it is, and now, attention, only the groins move forward and down, very slowly, always targeting the groins. Don't give in here, but give in here. So, don't let your stomach hang, but the groin. Let the groin come down, pull the belly button back as shown before. Pull the belly button in a bit, and you'll notice that it feels very different than if you were to let your stomach sag. And finally, it's not a problem if the back also goes into a hollow back. There's nothing wrong with that. But the most important thing is the initial phase, where it's all about the hip flexor first, and then the chest muscles are added. Therefore, we have a complete stretch. What we have done now, what Sina has done now, is extending the shortenings from the front, and now we are going to the back. Come on, I have to announce something important right now. Namely, we have here our pain-free guide for the lower back. Look, everything is explained here. The exercises are included. Fascia rolling massages are included. Everything is described in it. Please download it in the link below the video. Use it. Now we continue with the back. We said the front is stretched, but there is tension still in the back. I always say this built-up tension also needs to be released. Please bring your feet forward, Sina. And now it's simply about sitting down, knees at approximately 90 degrees, soles of the feet together, and now pull forward a little. And if you notice that the feet can go a little further forward, then slide them forward. Or move your buttocks backwards. Yes, it is important that you feel the stretch here. If for any reason you cannot reach the floor, it is too strenuous, you can also do the same exercise on the chair. Sina, please go to the chair. And while doing this, don't sit all the way back, but maybe in the middle. Be careful not to sit too far forward to avoid sliding off. Place your feet a bit forward, again in the same position, and just let yourself hang forward. And as mentioned, the height at which you personally practice is completely irrelevant. The main thing is that it pulls in the lower back so that you can still bear it well, that you are just in the comfortable pain. Moreover, you should not move quickly or jerkily.